You are on the front line of this pandemic. Every one of the almost 10,000 recovered Albertans is your success story. Thank you for your work on this front, as well as your work to care for all the other health needs of Albertans during this new normal. I also want to thank the first responders, continuing care staff, and others who have continued to go above and beyond to help support our loved ones and ourselves. And thank you to the many others who are on the front lines of supporting our society. I'm talking about the truck drivers, grocery store clerks, retail cashiers, and service providers who are the reason that we can buy food and necessities, get our teeth fixed, our hair cut, and enjoy a meal we didn't have to cook, all in a safe way. I also want to recognize everyone working behind the scenes at Alberta Health Services, Alberta Health, Indigenous communities, and in the municipal and provincial government. The pandemic has brought a great deal of work for all of us, and I know that many people have been putting in long hours to keep all of our communities healthy and safe. Turning to today's update, I'm pleased to report that we have identified just 56 cases in the last 24 hours, and conducted almost 8,000 tests. Alberta has now conducted more than 735,000 tests on almost 608,000 people. About 1 in 7 Albertans have now been tested at some point. Currently, 76 people are in hospital, including 19 in intensive care. Sadly, I must also report 2 additional deaths, one of them at the Good Samaritan Southgate Care Centre in Edmonton. There have now been 205 deaths in this province. Every one of them was someone who mattered, who loved and was loved in return. My heartfelt condolences go out to everyone who has lost a loved one to COVID-19 or any other cause during this pandemic. Today's case numbers continue a week-long trend of fewer than 100 new cases per day. I am cautiously optimistic that Albertans are taking health measures more seriously, including distancing, hand washing, and masking. Of course, we are not out of the woods yet. The spread of the virus over the coming weeks will depend on the choices we make this weekend and in the days and weeks ahead. The recent cases we have identified are not limited to any one region or age group in the province. While the bulk of new cases continue to be found in Calgary and Edmonton, rural areas have also seen a significant number of cases identified. Although 20 to 29-year-olds remain the largest driver of growth, the rate of growth in this age group has slowed a little, and it has been encouraging to see that recent cases in this age group have fewer close contacts. Many recent cases have been linked to households or neighborhood clusters, which is a reminder that when you are feeling ill, it is important to not only stay at home, but also away from others in your household until your test results are available. The key message here is that everyone is still at risk of contracting COVID-19, even from family members and neighbours. We are now in the 6th month since this virus was first diagnosed in Alberta. I know that it has been a long, tough road. There has been a lot of talk about vaccines lately. There are a number being tested around the world that show promise, and I hope that a safe and effective one is identified as soon as possible. However, the focus on a vaccine can sometimes give a false confidence that the end of COVID-19 is just around the corner. It can make us think that if we resist changing our personal behavior for just a few more months, then a vaccine will arrive and we won't need to worry about modifying how we act. However, we cannot know when or if a highly effective vaccine will be identified. Even then, there is no way to know for sure when a vaccine would be available to Albertans. It may take multiple doses over many weeks for our immune systems to develop sufficient disease-fighting antibodies. The hard truth is that we will likely still be fighting COVID-19 in 2021, so we do need to build good daily habits now. We have come far since March, but the basic health measures required to limit the spread remain the same. For the health system, we must identify, test, and care for cases while quickly tracing and isolating close contacts. That's why we are working hard to reduce the time it takes to get tests done and results received. For all Albertans, we must keep our distance from others outside our household and cohorts, wash our hands regularly, stay home if we're sick, and wear masks when we're close to others outside our cohort and household. When these measures are followed, our cases go down. When they're not, our cases go up. We must all embrace the changes that are part of living with COVID-19. That means continuing each day to make wise decisions that make life safer, regardless of whether case numbers are rising or falling at any given time. This weekend, I am asking all Albertans to make one small change in their lives. If you don't have a mask, please get one. If you haven't instructed your kids on how to wear masks safely, take time to do that this weekend. If going out to eat, shop, or be in close contact with others, make sure you're feeling well, wash your hands, carry hand sanitizer, and follow all the guidance that we've put out. We are going to be living with this virus for some time, so we must also celebrate the successes that we see around us. With that in mind, I started today by saying thank you to the many people who are keeping us safe and healthy. But I wanted to save the biggest thanks for last. Thank you to everyone who has embraced the public health measures and guidelines and made them your own. Thank you for incorporating hand washing, physical distancing, and staying home and getting tested if sick into your new normal. Thank you for working within the limitations of your cohorts to maintain your social connections and activities while protecting others. Thank you for bringing your own utensils and food to social gatherings, for using your elbows to press elevator buttons, for wearing a mask in public indoor spaces, and for your many kindnesses to people at greater risk or who are more isolated. The most powerful tool we have against COVID-19 is our collective attitude, the strength of mind and community to stand up against a threat and protect each other. Some things have changed since March, but one thing will always remain true. We will always be stronger together. Thank you, and I'm happy to take any questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
Thank you. Yes, the first question is from Kevin Nimick of CTV. Please go ahead.
Hi, Dr. Hinshaw. Daycares and after and before school care programs are still capped at 10 kids per room right now. Why is this the case if you aren't setting a limit on the number of kids who can be in a classroom at a school? And earlier this week, you said younger children are less likely to catch COVID-19 and develop serious symptoms. Why then are there more restrictive rules for young children in daycares than there are for older students in schools?
So my understanding of our guidance, and perhaps that's not clear on our website, was that effective on June 15th, when we moved into stage 2 of relaunch, that the maximum for daycares and out-of-school programs was 30 children per cohort. So I'll have to make sure that that's clear in our online materials. But we did increase that, and we haven't seen significant issues with daycares or out-of-school care programs with that increased cap of 30 children per cohort group. Or I should say it's 30 individuals, that includes staff. So it could be, say, 28 children and 2 staff, depending on the ages.
Operator, can you put through the next one, please?
Yes, the next question is from Helen Pike, CBC Calgary.
Hi, I am wondering, as September approaches, what you anticipate the need for testing will be before, students go back to school?
We are looking at testing right now and wanting to decrease our turnarounding to make sure that there is availability for anyone who may want to be tested before returning to school. One of the things that is an important consideration for parents is if their child, for example, has allergies or some kind of chronic condition where they may have some symptoms that could also be symptoms of COVID, like a runny nose or a cough. It's important before school to take them for a baseline test to ensure they have at least one negative result, and then they can monitor their child, and parents know their children best, so if that child does have a change in their symptoms, it would be at that point that we would need that child to stay home and be retested. But now would be the time for parents, again, who have children who have some of those chronic symptoms for other medical reasons, to take their child in for that baseline test. With respect, again, to that total volume of the demand where we may have more parents, teachers, or students who are interested in testing, we're working very hard to increase access, reduce turnaround times, and make sure that we do have that access over the coming month.
Operator, can you put through the next question, please?
Thank you. Jason Herring, Calgary Herald.
Hello, Dr. Henshaw. Given that we've seen over the past week significantly lower daily case rates than previously, are we able to say that we've gotten past the spike that we've seen over the past month? And what message should Albertans take from this?
I think whenever we see our case numbers go down, Albertans should feel collectively proud of themselves. This number decline doesn't happen without a lot of work from a lot of people to change the way that they go about their daily lives. It doesn't, however, mean that COVID is behind us. I think we saw as our first wave came down, our numbers declined. We had a time for a few weeks where we were quite stable, and then our numbers started to climb, I think, as people felt that perhaps COVID was over, they didn't need to worry about transmission. So the message I would want people to take away is that, again, we should feel collectively proud and take this as an encouragement to continue reinforcing those daily practices in our lives, because the future, and whether we have a big second wave, whether we have a series of small kind of ripples or smaller waves, that really is in our hands, and it's all up to how we interact with each other. And so that's, again, that message I would want to reinforce is what comes in front of us in our future is really up to us in terms of our case numbers. And we can, as has been shown over the last while, when we work together, we can bring our case counts down. And I think that is what has happened over the last couple of weeks as we saw a concerning trend in that rise in our hospitalizations, ICUs, and cases. And we're starting to see that reversed. But again, it will take ongoing work to keep that trend low.
Operator, can you put through the next question, please?
Thank you. Stephanie Rousseau, Radio Canada.
Hi there, Dr. Henshaw. I'm just wondering, given that we're seeing lower numbers, what does that mean for the timeline for phase 3?
The question about stage 3 is an important one. It's certainly one that we will hear more as our numbers are low, which is definitely encouraging. We have in front of us in just a few weeks the opening of schools, which will be a significant change. And so what we're doing right now is looking at what stage 3 would look like, what the timing of that would be. No decisions have been made yet. But again, the reopening of schools will be a very significant change, and we want to be cautious to make sure that any other decisions we might make take the school reopening timeline into consideration.
Operator, can you put through the next question, please?
Thank you. There are actually no further questions in the queue.
Okay, well, thank you all for joining us today. Dr. Henshaw will provide her next update on Monday afternoon. Have a safe weekend.